South Africa and the South African Medical Association embarked on a march to the Gauteng Premier's office last week to highlight the challenges facing healthcare facilities and professionals in this country. Sat in Pretoria, well, we've got Dr Mahlane Phalane of the South African Medical Association. He's in our Pretoria studio. Good morning, gentlemen. Thank you for joining.
Country is that we talk too much and in colorful language. We regard health as a priority, as the government correctly identified. It among you see, if you look at the 8 pillars of our PPE campaign, for example, we've got safety there. As we speak now, there's a doctor who was at Mpumalanga.
Yeah.
These are the kind of living environment that we are faced with every day in our healthcare system. What we are calling for, the mistake some people make is that when you call for a safe working environment, a doctor and a nurse or a health professional's working environment, it's a patient environment. You can't separate the two. If doctors are not safe, patients also won't be safe. That's why you'll see babies being snatched from a maternity ward. We don't want those things to happen. We need to have national norms and standards that are going to be enforced. When we say security standards should be in this way, all hospitals, all clinics should follow that. Those that we should make sure that we fix that which is broken, we provide that which is lacking, and remove that which is redundant, so that we can move forward with our healthcare system.
Simphiwe, back to you here in Johannesburg. I hear those concerns, and those are legitimate concerns, but there are successes within the healthcare system in South Africa. But it seems as if whenever there's reportage on health in this country, it's the negative stuff that gets onto the front pages of newspapers. Why is this?
I think this is it's a challenge. I think largely it has been blamed on the media, and I think one will also be calling on the media that, I mean, for instance, if you check back in 2009 when the current administration started, you look at the life expectancy then, it was at 55, but now it has increased. It's around at 59 to 60. Now, that is due to the successes which were made in terms of the provision of ARVs to, you know, increasing access to maternal health and all those things. These are beautiful things that we must celebrate. But you know that it would say that people don't want to sell the newspapers, then they would focus more on the negative. And such thing is something that we discourage, because we have a lot of doctors and nurses that are still in the public sector, serving about 86% of the population. And those doctors chose that they are going to sit to serve the public instead of going for greener pastures. And we think that the media can play a role in encouraging these people to stay within the public health sector system.
Dr. Phalane, you spoke about security earlier, and I think that's probably uppermost in the minds of most of your members. How do you change this? How do you change security at hospitals, and what kind of plans does your organization have to take this and to make it more safe to practice health, medicine really, in this country and work at hospitals?
We will remind you that when we embarked on a similar march in 2009 and handed over a memorandum to the Health Minister, Dr. Mahlane Phalane, the issue that was overemphasized was the issue of OSD. But it's inseparable to that issue was the issue of conditions of service for our members. Because our members are extremely overworked, we have issues of lack of resources, where you can find that the backlog or the waiting period in certain, like in orthopedics in most hospitals, patients can wait up to 1 year. You can imagine doctors and nurses who work in those departments, how much strain do they have to carry? And also the other issues that you will see the media sensationalization, as you said. If you have reports maybe from the Health Professions Council saying about doctors are drug addicts and drunkards and stuff like that, because only 4 maybe of them might have been found guilty of doing that. Yeah. We don't have support of our professionals who are working extremely under inhumane conditions. You've got hospitals that are run by maybe only 4 doctors. That will mean those doctors will be on call 24 hours every second or third day. And we don't even want to talk about the burden of disease that came with communicable and chronic disease like HIV and TB. We don't have a human resource plan that will deal with the current problems, the current chronic shortages, and even plan for the future in particular. We need to have a way. We are glad that nursing colleges are going to be reopened. We are also glad by the strides made to increase the number of doctors, undergraduate doctors that we produce. But our grave concern is the issue that we have what we call a broken bucket system. Yeah. Where we pour in these graduates, the equal or more amount of doctors are exiting the system. Either most doctors are doing non-clinical work, some went abroad, others most of them are in private. Yeah. Because we don't have recruitment and retention plans in our healthcare system. You could go back to the Tembisa story again, where the junior doctors were locked out of their accommodation that was organized by the hospital and the department. How do you retain such people who had to sleep in casualty for 2-3 nights? Yeah.
I wanted to ask you about that and about the overworking of healthcare professionals. And you mentioned earlier things like drug abuse and alcohol abuse. Is it a scenario that if you overwork people by putting them on call for 24, 36, 48-hour shifts and so forth, is there a temptation then for them to having, or not a temptation, do they sometimes have to use stuff to keep themselves awake in order to perform?
The thing is, it's not a problem that it's unique to doctors or health professionals. You will know even in sport, the incident we had earlier, people doping because they want to have endurance and stuff like that. Yeah. We cannot isolate it and let it be peculiar or specific to the health professionals. But it's not only about the overwork itself, it's also about the nature of work. Remember, as the medical or health professionals, we work where society will ordinarily run away from. If somebody is stabbed and the knife is stuck in the chest, where do you take that patient? You take that person to be seen by nurses and doctors. We are human as well. Those kind of things that we see are very traumatic. The question is, which kind of support is provided to our members who are under distress? The same doctor we're talking about who has been attacked and fractured a shoulder in Tembisa Hospital, he's on record saying he didn't get any form of support, though there are contradiction reports on that issue. That's why we even went in discussions with the South African Council of Churches to say, we understand we might be having shortage of professional counselors, your psychologists and social workers, but we think they've got a role to step in and play those who may seek and opt to get such services so that they can provide, not just for health professionals, also for patients, and in particular for patients.
Well, Dr. Mahlane Phalane joining us from Pretoria. He's with the South African Medical Association. Thank you very much for those contributions today. I just wanted to close with you, Simphiwe, here in Johannesburg, and you've got about 30 seconds, and I know it's not a short answer, but are we on the verge of a collapse within the healthcare system in South Africa?
No, I would not say we are on the verge. I think there's still hope. I think if we can embrace this PPE campaign, would be, in the right direction to making sure that we save our healthcare system. And that is why we strongly call upon government. There must be a political will that we must be able to save. It should not be just, a talk show only. We understand that it's in the 5 priorities of the ANC, and we call on the ANC government to make sure that health, as it is a constitutional right, that we fix it.
Thank you very much for joining us, Simphiwe Gada, who is the spokesperson for DENOSA, that's the Democratic Nurses Organization of South Africa. Let's just take another look at your